reason. So my name is Maxine Mackintosh, and I lead the Diverse Data Programme at Genomics England. You'll be able to see from this slide, I also don't know how to spell honorary, so apologies for that. But I'm also involved in a number of different communities. I love a community of practice. So two that I'm particularly involved in is one called One Health Tech and another one called Data Science for Health Equity, both of which are looking to improve diversity and inclusion in health tech. And then when I want like a bit of like quiet, soulful time, I will then hide in the Alan Turing Institute to do academic research at the intersection of sort of AI, fairness, and data. So if you're not very interested in genomics or don't know anything about genomics, don't worry, this is not a too genomics heavy presentation, but this is really going to outline our kind of how the Diverse Data Programme at Genomics England frames this problem, some of the ways that we're addressing the problem too. Slight issue going after Joe is that we both come from a very small community of people who read similar papers. So you'll see quite a lot of similarities between what myself and Joe have presented in terms of the framing of the problem. But I'm hoping that means we're all just circling in the right direction is what I'm hoping. But yeah, you might see a few similarities there. Next slide, please. So this is the kind of big data bias problem that exists within genomics. Yeah, thank you, Joe, you did say it first. And so, all of our areas have a particular data bias problem. As was flagged by Ash at the beginning, it's very, very intersectional. The one that really stands out in genomics is that data sets are dominated by individuals of European ancestry. When we say European, we kind of mean white Northwestern Europeans. We kind of really mean like white North Americans, white British, and some of the Scandinavians, particularly Icelandics. And as you can see in this graph, the red is getting redder. There's more of it. So the proportion of genomic studies made up of Europeans is also increasing over time. Next slide. So you can cut this cake in different ways. It doesn't necessarily show you a more positive or representative landscape, but here you can kind of see that when you look at the kind of research output proportional to the participants in genetic studies, you see a similar image. Europeans really, really dominate the research output and research participant landscape. But you can also see that the East Asian research community kind of punches above their weight in terms of the number of studies per participants, but nevertheless, definitely not globally representative of ancestry. Next slide. There's loads of reasons why this matters, because we sort of morally think that diversity is good, and I think everyone is probably turned up to this webinar thinking that as well. But also it's quite important, I think, that we articulate exactly the impact that lack of diversity can have. And there's loads and loads of different ways this can negatively impact and positively impact in genomics, and this is just one of the examples I wanted to flag. So polygenic scores, doesn't really matter if you don't know what a polygenic score is, think of it just like a risk score. But a phenomenon that you see quite a lot is that if you train this risk score on a population that's, say, largely of European ancestry, and you apply that to different populations, by and large, on average, when you apply it to, say, individuals of African ancestry, those scores are about 4.5 times less accurate, which means that kind of generally they don't tend to translate super well. This, in fact, varies by sort of relative and absolute sample size. It varies by trait, but nevertheless, like this is the general image that we see quite a lot when it comes to polygenic scores. And there's loads and loads of these different examples in terms of where the lack of diversity can have quite significant impacts in genomics. Next slide. It's important to kind of nest this in the context of the fact that, of course, our healthcare is becoming increasingly digitized. That really matters in the context of Genomics England, because a lot of what we do is we link whole genome sequencing data and phenotypic data we find in your medical records. Next slide. And of course, we've had a kind of particular period of sort of turbulent change, particularly around axes of deprivation and ethnicity. So this has made it a kind of very, very live topic. And again, the scene was set, particularly by Ash at the beginning, that this has been a particularly timely topic. Next slide. It's also important to nest the genetic stuff in the context of the fact that this raises questions about human migration. We need to take into account that lots of other initiatives across the world are sequencing their own populations, which inherently creates a different kind of diversity. And then the kind of bottom left is that we do have a sort of fairly recent ugly history, certainly in the UK, certainly down the street at Gower Street, of eugenics. And all of that is sitting within this mix when we're thinking about diversifying and equity within genomics. Next slide. So I've got this quote from Ruha Benjamin, who's one of my favorite scholars. She's written fantastic books. My favorite one is Race After Technology, and it really is around the intersection of where ethnicity and race intersect with technology. And she has this quote that says, data and technologies are socially constructed and embed design decisions, assumptions, values, and ideologies that can be discriminatory and generate social harm. In effect, that's kind of saying that we look at a data set, but actually what a data set is doing is it's capturing a lot of our values and our practices in society within that data. It's not just a heap of numbers and a bunch of rows. Next slide. And so when we're thinking about what the problem actually is when it comes to data bias, we've really got to zoom out and be able to look at the kind of the big macro issues that are setting the scene for imbalanced data, right to the very, very specific manifestations of bias. And so this is a kind of nice schematic that a friend and colleague, David Leslie, put together to kind of map all the weird and wonderful ways in which bias can creep into the health data sets that we use on a regular basis, particularly for people who have turned up to this webinar, I suspect. Next slide. So Ruhar's quote was very sort of sensible sounding and quite academic. I think I was going to complement that with Adam Rutherford's quote in a book called Control, which is about eugenics, where he says, "We must always expect science to be misrepresented, overstated, and misunderstood because it is complex, because the data is unending, and because people are strange." And the reason why I include this is that when we're working with health data, we are capturing data that's incredibly sensitive, incredibly personal. It captures data that deals with human interactions, and it's not quite as simple as breaking it down into these really, really specific, quite discrete ways in which bias can manifest, but it's capturing a whole range of different sensitive, truly human interactions. Next slide. So that's just setting the scene for what on earth diverse data is and Genomics England. So just in a single minute, probably a bit less because I'll run out of time, but many people on this call might know that Genomics England as a kind of brand and an entity, but exactly what Genomics England now does is probably lost on some of you. So GEL, which is the acronym we use to describe Genomics England, GEL was set up about 10 years ago to run a thing called the 100,000 Genomes Project. Whilst that sequencing is finished, and that was sequencing, in the end, 78,000 participants with cancers and rare diseases. The analysis is very much ongoing, but once that data collection was finished, there's a period of sort of soul searching and head scratching whereby GEL kind of thought, well, we've got this great asset, we've got these people, we've got this great data set, we've got a great team, how can we evolve? And so now Genomics England provides the back end to the genomic medicine service, and then for people who consent to their data being used for research, that then goes into a thing called the National Genomics Research Library, which is a kind of large data asset. And then there's a bunch of different activities that happen around that core offering, of which diverse data is one. Next slide, please. So diverse data is a kind of fairly new initiative at Genomics England. We're a sort of £22 million funded programme, and we are halfway through a 3-year programme, which is very exciting. Can't believe how quickly time has gone. I've become more grayer, I think, as a result. And the programme was set up to reduce health inequalities within genomic medicine. And really our kind of main outcomes are gauged against these sort of 3 areas. So one is around trust building of communities to date who've been excluded from precision medicine efforts. Another one is expanding and improving research, particularly around populations to date that just have not really been researched or excluded from research efforts. And then thirdly is around looking at questions that have kind of clinical relevance. So we aren't really interested in capturing questions of human migration, whilst those are very important. Our questions are very much around ones that can have kind of near-term clinical impact, and that's partly because of our proximity and relationship with the NHS. We've got a range of different focus areas, which I won't kind of delve into right now, but they range from specifically looking at conditions, looking at ways of working and practices, and looking at more foundational methodological approaches. Next slide. Across all of our focus areas, we by and large have the same sort of levers. So we've called them the work streams. So this is how we approach those kind of 5 focus areas that you saw on the left. And they're kind of what they say on the tin, but just to kind of read them out. So research and discovery, that's our understanding of how bias manifests in our practices and the data that we use, but also conducting novel research from a kind of discovery perspective. Secondly, community engagement for us, this is top down and bottom up. So top down, how do we work with other major institutions, like HDR UK or anyone else in the ecosystem to make sure this is on their agenda, but also how do we work with community groups and patient groups to really understand the reticence, concerns, hesitations around engaging in genomics research to date. Our third work stream is probably the most expensive one. It's where we're going to be creating quite a lot of new whole genome sequencing data. So we'll be sequencing over 15,000 individuals from underrepresented groups. And then fourthly, products, tools, and behaviors. So it's all well and good having a really nice, diverse data set. But if no one changes the way they practice, no one changes the approaches they use, no one changes the methods that they use, we're never going to see an improvement from an equity perspective. So our last work stream is very much around how we support individual practitioners with the practical tools they need to make their work more equitable. Next slide, please. Ooh. So this is, it's very easy to kind of think that this is a data problem. We are called diverse data, and to really kind of localize on thinking, okay, you just need to plug some data gaps and that will solve the problem. Next slide. But in reality, and this is another a hark back to Joe's presentation as well, is a fantastic paper. The fact that both of us referenced it means you should definitely read it. But it's because we've got this kind of great pipeline of different ways in which bias can enter into a research pipeline. And so we need to hit our solutions and interventions at every single point. So I just want to go through and really quickly illustrate some of the ways that we're doing this within the diverse data team at Genomics England. Next slide. Next slide. So the first one is on the questions that we pose. So it's all well and good having a fantastic new sickle cell genomic data set, but if researchers ask the same questions they've always asked, we felt that you're kind of missing a trick here in terms of really involving participants. So we're going to be doing a thing called a priority setting partnership with the James Lind Alliance, which is a trusted methodology by which we can create a patient-centered top 10, effectively like research protocol, research agenda, which means that we can then spend the next kind of 18 months creating the sickle cell data set and co-locating this with a new priority setting partnership. So at the end, we've got a mechanism by which to have the research community really coalesced around a patient-generated research plan. Next slide. The next one is that, and I alluded to it before, but obviously we are going to be putting our hat in the ring and doing our bit for actually improving the data diversity. So mostly our priorities are looking at sickle cell, which has really been massively neglected to date by the genomics community, despite it being a very, very prominent condition, particularly in individuals of African ancestry. Our second area that we're going to be creating quite a lot of new whole genome sequencing data for is maternal health, and that's largely driven by the huge disparity in outcomes for maternal care, particularly across ethnicity. This is quite an interesting one because the biological and social determinants of maternal outcomes are complicated, but we see that as a kind of really wonderful challenge. And then more generally, we are across these different areas, making sure that we are focusing particularly on individuals of non-European ancestry in terms of the people that we are working with to sequence. Next slide. We're trying to think quite carefully about how we set up some of these studies. So, and some of these partnerships, we're largely or exclusively working via partners and with partners for a lot of our recruitment and enrollment. We aren't experts in sickle cell maternal health. We are really reliant on the clinical and scientific experts. But we are currently working, for example, across our maternal health domain by conducting a series of different focus groups, exclusively requested outside of the quote unquote white gaze, by which to really drill down about some of the barriers that particularly birthing people have experienced in engaging with maternal research, but particularly maternal research as it pertains to genomics. And therefore, how can we set the scaffolding up for some of our maternal health projects to make sure that we are from the beginning setting it up in a way that responds to people's concerns and needs that to date maybe have slightly been ignored, particularly in maternal care. Next slide. We're also being diligent about the methods and approaches we use. So more on the analytical front. When we arrived at Genomics England, people were bucketed into these kind of very crude continental ancestral groups. And it's, anyone who's not Northern European will know that they don't fall nicely into most of these buckets. And so one of the first things we did is we tried to create a finer grained characterization of ancestry. So we've gone from 5 groups to about a dozen. We could still do better, but that means that people to date who've been miscategorized or incorrectly categorized or would fall between the gaps have been better categorized. And that has massive implications on all sorts of things from the research to the care they deliver. So this is an ever iterating project for us, but we're hoping to get to a really, really fine grained characterization of ancestry so that everyone feels most appropriately represented. Next slide. And then lastly, before I appreciate when we move it over, we want to take into account the broader context. So this is a new project that we're kickstarting called Link 23, which is around how we can curate and create and collaborate over tools that improve genomic equity. So this is set up as to be a very external facing global open source project. We're kind of in the process of launching, we've soft launched, but please watch this space if you are interested in the intersection of open science and equity and genomics. Next slide. Next slide. I'll skip over. So this is just the wonderful team from whom I've nicked all their wonderful ideas and presented back to you. And then next slide. There we go. Thank you so much.